I am Dr. Prinky, and I'm standing in one of the treatment rooms at Talley Cavey Chiropractic. You can see an adjustment table here beside me, our computer system where we keep notes and files on our patients, and behind me, passive therapies like electric muscle stim and the roller table that everyone loves so much. What you can't see are some other different therapies. Over here behind that wall, there's a decompression table, which we'll use to help patients both with neck and back problems, specifically disc issues. And back over that way, we've got an area for stretching and exercising. It's really a combination of things that we use to help our patients to achieve optimal results. And today I want to talk a little bit about getting those optimal results through chiropractic care. What I treat as a chiropractor is referred to as what is called a subluxation. That's a misalignment in the bones of the spine that creates pressure on the nerves, the spinal cord itself, and the spinal nerve roots that exit through openings on either side of the spine as the spinal cord and spine descend down through the back. And here's a model of a vertebral motor unit. That's a bone, a disc, another bone, the spinal cord here, and the nerve roots that are exiting. And it's this nervous system that is your body's lifeline. It is how your brain controls and communicates everything that happens in your body. So it's very important that there is no pressure or interference in the communication between your brain and your body. Your brain controls and regulates everything in your body. Muscles, joints, glands, organs, blood vessels, they're all under the direct control of the brain through nerves. So we want to make sure that there is nothing interfering with the communication between your brain and your body so that your body can then function at its absolute best. Now, these subluxations are misalignments in the bones of the spine that pinch or compress the nerve roots and create pressure and tension on the spinal cord, and this disrupts communication. Eventually, it can lead to pain. We're also concerned about that pain, but mostly it's really a state of overall health and function that we're after here. So we want to remove all of the pressure from these nerves, restore normal position and normal motion in the joints, allowing our patients to do the things that they want to do when they want to do them and with the people that they love the most. So subluxations occur as a result of different types of stress. Now, anytime I say stress, people think emotional stress, which yes, that is one form of stress, but there is also physical stress and chemical stress. All types of stress can cause misalignments in the bones of the spine, pressure on nerves, the disruption in communication between the brain and the body. And another thing that happens is that the discs in between the bones will begin to break down as a result of this misalignment. It is motion that feeds and nourishes the discs in between the bones. They receive the fluid and nutrients that they need from the bones above and below when the joint moves like it should. When a joint is subluxated, it is creating pressure and tension and interference in the nervous system, and it is also restricting the motion in that joint. That reduced motion means less fluid and nutrients get to the disc, and over time, we lose disc height and bone spurs form, and that creates even more pressure, and now there's a lack of motion in the joint because of this misalignment that's been present for a long time. So we want to clear those misalignments from our spine and nervous system in order to keep things functioning and moving properly. Now, we have to be specific about that because the nervous system is critically important. So we go through an exam process, x-rays, we determine exactly what the problem is, and then we come up with a treatment plan that fixes the problem. Not just alleviate the symptom, but fix the cause of the symptoms. And that's our goal, to restore normal position and motion and thereby restore optimal health and function. Now, that is a better approach to covering up than covering up the symptoms. Covering up the symptoms with, say, a medication, or in extreme cases, a surgery, which all too often are ineffective, At any rate, covering up the symptoms allows the problem to continue to get worse. Maybe we're not aware of it because we've masked the symptoms, our body's warning sign that there is in fact something wrong, but that doesn't mean that the problem has been fixed. As an example, if you think there's a fire in your house, the fire alarm is going off, so you take the batteries out of the fire detector, the smoke detector. You wouldn't do that. At least I don't think you would. Taking a medication to mask symptoms is pretty much the same thing. Don't let your health deteriorate while you're blissfully ignorant of the symptoms. Fix the problem. We look forward to seeing and helping you here.